The biggest challenges I hear from our clients is staffing. They're calling us at a moment of desperation, and they don't have time to wait when they call us. They're calling us desperate for personnel because they're already behind on their tasks because they've had a revolving door occurring over the past couple months, 6 months, a year.
I know the pro and con of trying to hire people, especially people with any kind of industry experience, is almost impossible. We searched as much as we possibly could for local people that had the ability to do the roles that we wanted, and we wound up not getting the quality of applicants that we thought we could get.
TBO was born out of home oxygen and the necessity of just needing people.
Well, we had our own business and we had problems with staffing, and there was a revolving door of staffing, and we couldn't keep people long enough.
But all of a sudden we had to take a look at what we were spending on our salaries and hourly people, and we concluded that we had to do something to try to cut costs.
We have thousands of patients, and it's so hard to call everybody on a regular timeline, but we manage now.
I wanted to focus on healthcare. I wanted to focus on the operating systems that we were using, and I wanted to train them. I wanted to train them the way I needed them to perform at a higher level to achieve the KPIs that we were looking for.
We're focusing more on the interpersonal skills and finding people that are, going to be honest with their job and that are going to show up to work 100% of the time.
We have probably 30 American workers and probably about 50 Philippine workers.
We monitored it quite strictly for, I'd say, the first 6 months to a year. After that point, it kind of took on a life of its own because they proved their value.
And we started off slowly. So we started off with just a person working CMNs or prior authorizations, and then we moved on to intake, and then we moved on to other aspects of our business where 80% of our call center was replaced by TBO over the next couple of years.
Just having the volume of staff that I do helps with everything. They're not a separate team, they are the team. And so we include them with everything that we do, and they're like a family.
They have become de facto employees.
So we've had clients give us feedback on how friendly the staffing are and how happy they are that they're able to connect with them from day one.
The talent alone, we're hiring nurses, therapists. These people are smart, they're highly educated, and they just want to work. I wish I could hire them for every position that I have.
We had one person that just wasn't working out. Within days, he had a replacement person for us. And I mean, that's customer service. He's taking care of us, and I mean, I couldn't ask for anything more than that.
They're just nice people, and they just want to please you, and I can't say anything bad about them.
Our turnover rate in training is about 40%, but that helps us because our turnover rate with the client, once they get with the client, is about 1%. That is something our competitors can't claim.